Well, hip arthroscopy is a technique that's applicable to a wide variety of patients. You'll get young teenagers who are doing activities such as gymnastics or ballet dancing who will get a labral tear, which will be treatable with arthroscopy. You'll get the young, more aggressive athletes in their 20s and 30s doing sports such as basketball, baseball, football, hockey is a real common one. And you'll get the middle-aged athletes who are doing tennis, golf, and running, and they'll also need hip arthroscopy as well. And lately we've also been exploring the possibility of delaying the need for hip replacement surgery by treating people with early stages of arthritis as well.
So what are we able to accomplish with hip arthroscopy? The fact that it's a minimally invasive procedure lends itself to a faster recovery from a traditional open surgery. And what we end up doing is, by looking inside the hip joint, we have to open up or distract the hip joint and insert a camera with a telescope called an arthroscope. And this allows us to really visualize the inside of the hip joint. And we're able to clean up damaged tissue, repair damaged tissue, remove debris, and even remove damaged cartilage that can allow a faster recovery than traditional open procedures.
I'm a runner and I go running every day, and in the beginning it started out with just a little bit pain when I moved my leg, but afterwards it was getting more and more. And also when I did my yoga lessons, it started to be awkward to move in some positions, and that's when I started to really know I have to do something.
Yeah, Harriet's a great example of the population that we have here that like to stay youthful, that like to stay active, even though they may be middle-aged. And she was a very avid runner, and she would refuse to stop running despite having problems with her hip, but she just had to keep going, and that's not uncommonly seen in the Bay Area. She got to the point where she could have difficulties even crossing her legs or going up and down the stairs without having rather severe hip pain. And she tried physical therapy, medications, and none of this was helping her. It was a little frustrating because her x-rays were negative, but she came to have hip arthroscopy, which really helped her out.
The recovery from hip arthroscopy is really dependent upon the type of procedure that's performed. Generally, it's an outpatient procedure, so the patients can usually go home the same day or the following morning, and usually they are on crutches for a couple of days for up to a week, and some patients can actually return to work the very next week. Depending upon the extent of the procedure, they may have a recovery that might require several weeks to a few months.
The first time I noticed really a difference in terms of the hip pain was when I rolled on my right side in the night and there was no pain. That was when I really realized it's gone. 6 weeks after the surgery, I went out the first time running again, and I was told not to go over 2 to 4 miles. I did 6 and I felt perfectly fine. My hip was not hurting and I just felt like new.
Hip arthroscopy has actually been around for a few decades, but has had a fair resurgence over the last 10 years, and I think is probably one of the fastest growing arthroscopic procedures in the country. But because it's fairly technically demanding, only a few percentage of orthopedic surgeons perform this procedure.
If you are somebody who is suffering from ongoing hip pain that's been unrelieved with traditional, more conservative measures, that you should seek out the opinion of a specially trained orthopedic surgeon who is familiar with hip arthroscopy for an evaluation to see if this would be helpful to you.